everyone. I'm Veronica. I am a fourth year medical student at Dell Medical School, and I worked with Dr. Rosemary Peterson and Dr. Avila Edwards at Dell Medical School on this project, Cultivating Advocacy in Medical Students, the impact of a project-based curriculum in the pediatric clerkship. So a little bit about this project. First of all, physician advocacy can be defined as an action by a physician to promote social, economic, educational, and political change that can be identified through their work. Examples of this we can think of through advocating for insurance coverage for a medication or championing a need for an increased mental health for our patients, or even testifying in front of the legislator. Advocacy is a critical part of every specialty, and each physician has a unique responsibility given their education to advocate for their patients. Numerous professional and organizations have stated that this is a responsibility of the physician. While this seems to be a widespread acceptance, there's often not formal advocacy education within medical education, and often the role of advocacy remains undefined. So as part of the Dell Medical School Pediatric Clerkship, students could opt into a project where they could learn tangible skills through a lecture series and a project that is ongoing with Dr. Avila Edwards. So a little bit about the curriculum. Starting in the spring of 2020, there was a 7-week curriculum that was created for the clerkship students, and the students could opt in or out. They first heard about it during the clerkship orientation, and then they were invited to an initial hour-long advocacy lecture that kind of explained the purpose of advocacy. And at the end, they were given a couple of topics to choose from, and then students were able to jump on an ongoing project that the advocacy director was working on. Topics included briefs on current House bills in Texas, policy research about specific topics, and then even guidance statements for pediatricians. They worked then with Dr. Avila Edwards and another medical student every week for 20 to 30 minutes with some outside work as well to kind of discuss the project, troubleshoot, and then continue. So the projects in themselves varied widely, as well as the deliverables. So to assess the curriculum, we created a 5 to 10 minute pre and post survey. In the pre-survey, students evaluated their interest in advocacy, first of all, how they defined it, and how confident they were in explaining advocacy related topics. Then in the post survey, we again evaluated their competence as well as the manageability during the pediatric clerkship, the average amount of time spent, and what was most helpful to students. So based on these results, 38 out of the 48 students in our pediatric clerkship actually opted in to participate. 27 completed the pre-survey, 17 completed a post-survey, and 16 completed both the pre and post-survey. We found that of the students that we discussed with, 80% of the students were interested in advocacy work, and these students often showed low confidence, so we used a Likert scale from 1 to 5. The mean at the beginning of the process was that they showed that they had low confidence in explaining, so a 2.48 in explaining practical involvement, 2.1 in defining different levels and explaining the policy process, as well as differentiating advocacy. We found in our research in this survey that actually after there was statistically significant increase in confidence in explaining the types of practical involvement, defining the different levels of advocacy, and being able to differentiate strategy versus tactics. The students were also asked about the level of helpfulness, and they found that overall, all the aspects of the curriculum were helpful, with the most helpful being weekly check-ins with Dr. Avila Edwards, as well as working with another medical student. And then also 87% of the students said that the time commitment was mild or less in the pediatric clerkship. So in conclusion, a majority of the students had an interest in advocacy work. There was an statistically significant increase in their confidence related to getting involved in advocacy work after defining the different levels of advocacy and being able to differentiate strategy versus tactics. These active projects that are real and are actually being worked on that will be facilitated through this through our mentor were found to be really relevant learning experiences for students, and students even continued after the clerkship. And even within the pediatric clerkship during a very busy time, students felt that it was very manageable. So this project gives a lot of opportunity for increased confidence in relating it to advocacy, and hopefully allows students to be more confident in advocating for themselves, patients, and systems. So thank you so much, and thank you to Dr. Avila Edwards and Dr. Peterson for your work on this project as well.
Great. Thank you so much, Veronica. Does this project kind of create an outline for it to be applied to other clerkships as well?
That's something we're definitely working on, is how do we kind of find a way for this to be accessible to other programs. We have the amazing opportunity to work with Dr. Avila Edwards, who donates a lot of her time to these students to create this project, to create, these weekly meetings and these things on top of her already busy schedule. So we're trying to figure out a best way to be able to replicate this in other areas. But I think this shows that some sort of tangible project is really relevant to students, and would definitely be beneficial and manageable in other programs as well. So stay tuned for that. We're definitely working on something.